everyone, my name is Elizabeth Inafuna, and today we will be talking about the socio-economic impact of COVID-19 on the different local communities in South Africa. The COVID-19 has a severe diverse implication and impact of South African society, including the social, economic, health, environmental, and technological realms. We have a total confirmed cases of over 1,538,000 and 1,462,000 recoveries and 52,196 death rates, and we have 22,302 active cases. South Africa entered this crisis and the lockdown with an already weak economy, really weak, with real GDP growth estimated at 0.3 and 0.9% from 2019 and 2020 respectively. In South Africa, the second wave was associated with higher incidence and more rapid increase in hospitalization and increase in hospital mortality. While some of this explained by increase in pressure on the health system, a residual decrease in mortality of hospitalized patients beyond this could relate to new lineage. The Tourism Business Council of South Africa is 58% of respondents said they have been unable to repay their loans in March, while 54% said they could not cover the fixed costs. Half said they have been forced to reduce salaries for more than half of their staff. We have over 1 million cases in South Africa. It's a good thing that people are recovering, but we don't want to count the cases. We want to reduce those cases, and I advise that we go through these restrictions and work towards them for the betterment of the country and you yourself. Thank you very much.
Everyone, my name is Okoshe Kasana. I am 18. I'm from South Africa.
Hello everyone, my name is Mlondi. My surname is Mashalela Zivanese. I'm a 17-year-old South African.
I'm Gilly Ayman, a South African student at the African National Academy. Good afternoon, Gillian.
Hi, Ivan.
South Africa. Good afternoon, Malik.
Good afternoon, sir.
How are you doing, Malik?
Fine, thanks. How are you?
I'm good, thank you.
It really made a huge change in my life, and when it came, it was a thing of man, it's just gonna last for a few weeks and then it'll be gone, everything will be back to normal. But yeah, that didn't happen, and I had to adapt a lot. And staying at home indoors all the time, that was really tough for me.
As the lockdown was introduced, it was quite a hard time, especially for me as a grade 12 student. So we were expected to be preparing for exams, yet when the lockdown hit, we were expected to stay at home. And as a young person who grew up in a rural area, most students didn't have access to other gadgets that they would be able to use to propel themselves forward in their academics.
So my life has changed drastically since lockdown was imposed. For starters, when lockdown was imposed, I moved on to Durban to be with my grandmother because she was going to be alone. So my whole of my 2020 was spent living in Durban. And if I'm being honest, I never really left the house, which did change the sphere of my social life. I didn't really have a social life, everything was virtual, and it was a very interesting experience.
Sure. So when our President Ramaphosa announced that we will not be going to school at first, it was very interesting to see that people actually thought that this was a very dangerous disease, which it is, but people thought that just by going outside, you're gonna die. As a result, with the lockdown restrictions being implemented, it was hard. It was a new life. This whole idea of now wearing masks, of socially distancing, no hugs. Well, no hugs. Mainly online. So in summary, my life has moved more online because of COVID-19.
Like many other countries, the pandemic has negatively impacted our country. Especially with regards to the economy, it pushed us deeper into a recession, and our unemployment levels rose even more.
Economically, it had, I think, one of the most drastic effects that I've seen, because during over like the lockdown period, 2.8 million people lost employment. However, I think through like good leadership, by the month of February, there was another 17 million more that were employed, and in the month of April, there was 14 million people who were also employed.
Level of inequality in South Africa. South Africa is among the highest in terms of inequality in the world. Yeah, our Gini coefficient is like 0.625%, which is very high. For those who do economics, you'll know that's very high.
I think COVID-19 has created a sort of facade to what people think about diseases in general, because now particularly things like flu, in fact anything like when someone is sick, immediately you think COVID, you know. That's what I think.
Fortunately, no, but I needed to go for my medical checkup for ALA, and also to get my COVID test. Those experiences were quite good, I would say. It was very organized. But we need to acknowledge that many others didn't have the same privileges that I did. You could see the difference between private healthcare and public healthcare, and those who had to rely on government healthcare were not as helpful as private.
Yes, I have been to like clinics and hospitals, so the conditions weren't as good, because there would be like long lines, and there was like less staff within the hospitals to help people. So long lines meant like a lot of people were there at the same time, so that might increase the chances of people actually infecting one another.
I had a sense of fear, because you know, like hospitals are hubs that treat people with COVID-19. Because of what I thought of and what I still think of COVID-19, and how, you know, it can easily get affected and how it can impact you. You know, many people have died because of this disease. It was pretty scary. Like walking in and thinking, okay, there's a high probability that at least one person here has COVID-19. But I like how hospitals are handling, particularly hospitals in South Africa, are handling the situation.
What I can say, first of all, let us all remember that COVID-19 is real, guys. COVID-19 is real. I think a lot of us are starting to forget that it's a real thing. It exists. And just urge that you carry on checking up on your loved ones, speaking to them, using the platforms that you have. So if you have access to internet, call your loved ones, keep in touch, doing connections, even though we are apart.
To everyone who's watching, I know this is particularly an interesting pandemic, because there are a lot of like conspiracies that are going out there. Some claim that the virus doesn't exist. Some claim that in terms of like spiritual perspective, some claim that it's not real, it's part of like a test from God. Like there's so many things that are being put out there that I've noticed a lot. But I think no matter what conspiracies you've heard, no matter what ideologies that you carry, please stick to the regulations of COVID-19 and like the restrictions.
We've become very accustomed to living like this, and we've gotten used to the entire protocols and social distancing. But we're still very much in a pandemic, and we need to acknowledge that. And we need to still comply to the rules and wear our masks and social distance. So please, everyone, just for this last push, can we just work together and comply?
COVID-19 is a disease like any other disease. It has destroyed many lives, destroyed many businesses, destroyed many people's livelihoods. But it's not the end. If we can all just follow the rules, laws, and protocols that have been set to protect us, to keep us safe, and for the better and the betterment of our society.